Okay, hi, I'm Stephanie McGrone here to talk to you about wound care. As you can see, I keep me some gloves. You always want to keep gloves. I've used some of these already, and oh well, I used a lot of them, they're empty. But I keep some Band-Aids. You will need this. Depending on how bad the wound is, you might need some type of bandage. You ever been to the hospital? Sometimes the hospital will give you things that you need. I keep some peroxide. I have some tape here in case you need a little extra hold. Now, when you're using alcohol, most people buy the bottle, but I do have the bottle and the alcohol swabs as well. The swabs are a little better, because just sitting there pouring solution on yourself could really burn. And I was telling everyone about the Saline wound care spray. This is the one that I use so far. I'm pretty sure there's several different brands. You can also find one at your local drugstore or the Family Dollar or Dollar General. It'll be an off-brand, or either it'll be cheaper, but it's very reasonable to get from any store. I have lots and lots of tape. I have to keep some tape around, as you can see. You never know what's gonna happen. A lot of things to take care of my mom with, like sometimes if you're a CNA, you might know what this is. Well, you should know what this is. These are cleansing wipes. These come in handy for people who cannot get out of the bed, but they need to cleanse and you want to wipe lightly if they have a wound. You can just take these. This one's already moist, but this one here is like in layers. You can wet it and it gets soapy enough for you to cleanse with. But it's a bland soap. It doesn't have any type of dyes or anything. It's very bland. Okay, here I have, this is from the hospital. It's like a bland body wash. A lot of people don't like it, which I understand, but if you have very sensitive skin, I would recommend it. And this here is for cuts and scrapes and burns. It's a Band-Aid solution. It's the first aid antiseptic pain relieving liquid. Now, I haven't used this personally, but I keep it in case something comes up. I can use it. But whenever I do use it, I'll be sure to let you know if it burns. Here's just a simple vapor rub. I'm pretty sure everybody have a little of this around their house anyway. I keep it for my mom. I care for her. And she likes to use that on her chest sometimes. Sometimes she put it on her feet. She said it makes her feet feel better. So, vapor rub you can do multiple things with. Like a lot of people use it to work out with. You rub it on your tummy, saran wrap it, old school, But, it's healthcare things, but you can use them several different ways. Okay, so, everyone knows what this is. This is some gall. And I want to demonstrate. Let's see. Do I have to use the arm? Yeah, I'll use the arm for you guys. If it'll stay in the air for me, I don't think it's going to stay in the air. If you have someone who was bleeding or it was like a wound, an open wound you want to cover, you would take the gauze, you would wrap it wrap it, wrap it, wrap it. Wrap it all the way until you get towards the ending, and you're just going to unravel what's left. Go over, then take your arm, your hand, go back this way. Here, I'll do it like this, it'll be better. Then you go back, go through, and you can kind of tighten it a little by pulling it. And then tuck what's excess inside, and it'll stay on just like that. I know that was kind of difficult for you to tell how I did it. I'll demonstrate it again. Let me unravel this. Okay. See, there we go. Okay. In the event that you have to care for someone with a wound on their leg or something, you want to take the gauze. You want to make sure you can see me very good. You're going to take the gauze and wrap the leg. Try to make sure there's no tangles and it's not so tight that it cuts their circulation off. But you do want to wrap it good as you can. So just, now I don't have much of the gauze left. So what I'm going to do is I'm going to put my hand right here. And I'm going to go backwards over my hand. And pull it on the other side. Then I'm going to go through where my hand is, pull it through, and this part will let you tighten it. Now you can do a bow, or you can do what I like to do, which is tuck the excess under to keep pressure. And there you are. You have a decent wrap. It'll stay put in place. So that is how you care for a wound. I'm just gonna undo it. There's another way that I was taught to do the ending that I wanted to show you very quickly. You do it the same way with the ending of the excess. You hold here, you go backwards, but you pull this up, and instead of you tucking it in, you tie them like a bow. Everyone sees that bow? You leave a bow, and then when it's time to change it, you take this part of the bow and just pull it, and it comes off. And you can unravel it. So it's very simple, it's not hard. I try to keep things plain as I can put them for you so you don't get confused about anything. And there's different types of gauze. Like here's some that I had got from the hospital. It's thicker and it's more like a padded gauze. And what it is, you can use it for extremely big wounds. You put it on, put some tape on the edges, and you cleanse it with saline spray. I think it's like every hour, every 2 hours or so you clean the wound. And you just keep everything in place. So if you have any questions about doing wounds or the infant choking, the adult choking, please do not hesitate to ask me questions. Comment below, ask me anything you want to know. I will be sure to answer your questions. And I will continue to make these videos to help whoever needs that extra assistance. I will help you by doing these videos. And I do classes online if you want to get your CPR license. It's very reasonable pricing and you can get the booking in the same day. I am taking applications now for classes, so please feel free to subscribe to me, to book me, call me, whatever you need to do so that we both can get together and do a plan for you. Just let me know. And I'm right here. Again, my name is Stephanie McGrone from Royal Assistance, and let's stay pretty while saving lives.